Have you or your family member had a stroke? Do you have tight muscles in your arm or in your leg? That's called spasticity. I'm Dr. Judy Gooch, and I'm here today to talk about treating spasticity after a stroke. After a stroke, spasticity is pretty common. Any injury to the brain or to the spinal cord can cause spasticity, leads to tight muscles and hyperactive reflexes. It can be painful, and it can make walking more difficult, and it can make using an arm impossible. It can also lead to a muscle contracture, which is where the muscle is stuck in the tightened position because the spasticity pulls on the muscle so much. There are treatments for spasticity. After a stroke, many people don't get ideal treatments. It's best to start as soon as possible so that you can learn to better use your arm or your leg and so that you don't develop a contracture. First, every day for at least a few minutes, you should stretch the spastic or the tight muscles. This will help prevent contractures. On another YouTube video on Utah Neurorehabilitation channel, we talk about how to stretch your arm and your leg. Braces for your arm or your leg can also help stretch and help you to better walk or to better use your arm. Oral medications can take the edge off the tightness. Baclofen is the one that's used most commonly. Dysport or Botox injections also can be used to treat spastic muscles. Dysport and Botox are both a type of botulinum toxin type A. This is a protein that's injected directly into the muscle to decrease the signal that goes from the nerve to the muscle and loosens the muscles. These injections can significantly decrease the spasticity in certain parts of the body. They take effect a few days after the injection and typically last about 3 to 4 months. The injections can be repeated every few months. Side effects can include bruising and pain, weakness in the muscles that were injected, and occasionally a flu-like reaction or a rash. I show how these injections are given in another Utah Neurorehabilitation YouTube video. Phenol is another substance that for many years has been used to treat spasticity. Like the Dysport or the Botox injections, it's injected into the muscle and it lasts for a few months. Sometimes some muscles are injected with Dysport or Botox and other muscles are injected with Phenol. There are also some surgical procedures to help treat spasticity or contractures. If you've had a stroke and have spasticity, you can talk to a rehabilitation doctor or to a physical and occupational therapist about how to treat spasticity. Treating spasticity after a stroke can really improve your life.